pain is very common. It is chronic and it can affect your productivity. In this video, I will teach you about the 5 things that you need to avoid to decrease joint pain effectively. Greetings again to everyone. This is again Doc Cherry, Doctor of Physical Therapy. If you're new here in my channel, please don't forget to click the like button if you find health videos like this helpful. Also, don't forget to click the subscribe and the bell button below so you will receive weekly health videos on managing different conditions that will help you and your loved ones. Your diet and lifestyle can either ease or worsen your symptoms. And since joint pain causes long-term inflammation, you need to avoid foods and habits that can worsen this. Because despite the medications and the exercises that you do, if you don't change your diet and your lifestyle, the results would be slow. Always keep this in mind. You need to avoid sugar and refined carbs. Consuming too much sugar causes the body to release pro-inflammatory proteins called cytokines that would encourage further inflammation in your body. For majority of you who have joint pain, your cytokine levels is already high. If you consume more sugar, it will worsen the inflammatory process, which can give you more pain, swelling, and stiffness in your joints. Consuming high sugar foods can also lead to weight gain. When you're overweight or obese, fatty tissues produces hormones that can put you into a more inflammatory state. In fact, obesity can lead to a more active and severe form of rheumatoid and psoriatic arthritis. As tempting as it is, you need to avoid sugar, and since soda is one of the biggest contributors of sugar, you need to say no to soda because a 20-ounce bottle of soda already contains 16 teaspoons of sugar. You need to be careful with the food that you buy. Check the ingredients. It is listed by weight. So if the sugar is in the top 3, don't buy it anymore. On the labels, sugar can be termed as sucrose, high fructose corn syrup. It could also be either cane sugar, maltose, and rice syrup. Do away with it as much as possible. You also need to avoid refined carbs such as white flour in the form of bread and pasta because it can cause a spike in your blood glucose that can increase the inflammatory response in your body. But just in case you are gluten sensitive, wheat products may also increase your joint pain. You need to avoid salt and preservatives. Too much salt is bad. For those who are 51 years old and above, those with high blood pressure, diabetes, or kidney disease, you should only get 1,500 milligram, about half teaspoon of salt per day. But on average, majority consume about 3,400 milligram of salt. Too much salt makes cells attract water like sponge. This retention of water increases pressure on your blood vessels that can raise your blood pressure and can also lead to kidney disease and heart attack. If you have joint pain, excess consumption of salt can also result in the inflammation of your joints. Always check the nutrition facts when you buy something from the grocery stores. This will tell you how much sodium it is in one serving of food. Check at both the serving size and the sodium amount. A single serving is often very small and you may eat more than just one serving. You need to keep an eye on these simple things that can unknowingly trigger your joint pain. You need to avoid fried and processed foods. Consuming fried and processed foods such as fried meats and frozen meals can actually worsen inflammation. If you regularly consume these foods, it can lead to weight gain, which will put extra stress, especially in your weight-bearing joints, such as your hip, knee, and ankle. Remember what I have told you before, that every pound that you will gain will result to 4 pounds additional pressure on your already painful hip and knee. Plus, these processed foods also contain trans fats to help preserve them. Trans fats can trigger overall inflammation in your body. On food labels, trans fat can be termed as partially hydrogenated oils, so avoid it. One mainstay treatment for joint pain, whether or not you have gone through surgery, is keeping an ideal weight. So be sure to swap processed foods to fresh food sources and offer healthier methods of cooking. You need to avoid alcohol and tobacco. Do you know that smokers are more at risk of developing rheumatoid arthritis, while those who consume alcohol have a higher risk for developing gout? If you are already drinking alcohol and you have joint pain, let me tell you that it's not good for you. Alcohol doesn't react well with many commonly prescribed medications for joint pain. If you are taking non-steroidal anti-inflammatory drugs such as naproxen, it can increase your risk for stomach bleeding. If you take acetaminophen or Tylenol to help with pain and inflammation, drinking alcohol can lead to liver damage, which we don't want. And since you want to get rid of your joint pain, cut out on alcohol for 4 to 6 weeks and see what happens. You will be happy with the result of your joints. Plus, you will notice that you will be able to sleep better. Smoking is also a bad idea if you have joint pain because it can worsen inflammation. Your synovium, the tissue that lines your joints, can get inflamed and thicken, since smoking can trigger inflammatory proteins called cytokines in your body. This can eventually lead to joint and organ damage because rheumatoid arthritis does not only affect the joint but the other organs as well. Patients who have rheumatoid arthritis and who smoke have a more active disease process than those patients who never smoked or have stopped smoking. Limit omega-6. Corn, peanuts, sunflower, and soy oils, as well as most meats, are high in omega-6 fatty acids. These are only healthy in small doses. Excessive omega-6 consumption can trigger inflammatory chemicals in your body. Meat, especially red meat, is high in saturated fats, which can lead to high cholesterol and inflammation. Try to limit your red meat intake because lower levels of omega-6 in your blood can give you less joint pain and better joint function. Thank you very much for watching. I hope that you find this video helpful. I would really appreciate it if you can click the like button if you do, and please do share this video to your friends and family members who are also complaining about the inconveniences of joint pain. This is again Doc Sherry. Stay safe, stay healthy. God bless you.